We have all had this moment, and most people completely misread it. You are lying in bed or sitting at your desk or scrolling on your phone, and your dog suddenly starts licking you. Not one or two happy little kisses. I am talking about fast, repetitive, almost desperate licking. They keep going at your hands, your wrists, your feet, maybe even your face. You laugh, you pull away, and you say, "Oh my goodness, you are being so affectionate today." But what if I told you that sometimes that is not affection at all? What if I told you that in many cases, that strange, frantic licking is one of the clearest ways a dog tries to tell you that something feels wrong inside their body? And here is what makes this so heartbreaking. Dogs do not have words. They cannot say, "My stomach is burning, my skin is on fire, my mouth hurts, I am panicking, I do not feel safe." So instead, they use behavior. And one of the most commonly ignored distress behaviors is licking. Hi everyone, I am Dr. Logan Wells, your neighborhood veterinarian, and welcome back to the channel. Today, we are doing a full masterclass on one of the most misunderstood dog behaviors ever. If your dog licks you like this, they may be begging for help, and I do not want you to miss the signs. We are going to talk about when licking is completely normal, when it is stress, when it is nausea, when it is pain, when it is allergies, and the exact red flags that mean you need to stop calling it cute and start paying attention. Grab a pen and a notebook, because once you learn this, you are never going to look at excessive licking the same way again. Let's start with Chapter 1, the dangerous myth about dog kisses. We all want to believe licking always means love. And to be fair, sometimes it absolutely does. Dogs do lick as a way to greet, bond, explore scent, and get attention. Some dogs lick because your skin is salty. Some dogs lick because it has become a comforting habit. Some dogs lick because they are genuinely happy to see you. But here is the veterinary truth. Repetitive, intense, poorly timed licking is very different from a few relaxed social licks. Normal, affectionate licking is usually brief, loose, and easy to interrupt. The dog's body is soft. Their eyes are relaxed. Their breathing is normal. They lick, they stop, they move on. A dog begging for help looks completely different. The licking feels compulsive. It is repetitive. It is hard to interrupt. It often comes with swallowing, drooling, panting, yawning, wide eyes, pinned back ears, pacing, scratching, chewing, or restlessness. That is not a simple kiss. That is communication. So the first lesson today is this. Do not judge licking by the tongue. Judge it by the context. Context is everything. Now we move into Chapter 2, the emergency tongue flick, the nausea lick. If your dog starts licking you, the couch, the bed sheets, the air, or their own lips in a fast, repetitive way, I want nausea to jump high on your list immediately. In veterinary medicine, lip licking, repeated swallowing, drooling, and restlessness are classic signs that a dog feels sick to their stomach. Sometimes owners are waiting for vomiting, and that is the mistake. A lot of dogs tell you they feel nauseated long before they actually throw up. This is the dog who suddenly cannot settle. They get up, lie down, get up again, lick your hand, lick the blanket, swallow hard, smack their lips, maybe run to eat grass, then come back and lick you again. Owners often think the dog is being clingy. No. Many times that dog is saying, "Something is wrong in my gut." This can happen with simple stomach upset. It can happen after they ate something they should not have eaten. It can happen with acid reflux, pancreatitis, parasites, intestinal irritation, or even a blockage. And that is why this matters so much. If the licking is paired with vomiting, belly pain, hunched posture, loss of appetite, diarrhea, or lethargy, you do not watch and wait for 3 days. You call your veterinarian. Please hear me on this. A nauseous dog does not always vomit first. Sometimes they lick first. Now let's go deeper, because not every distressed lick is from the stomach. Welcome to Chapter 3, the anxiety and appeasement lick. This one fools people constantly because it can look sweet. Your dog approaches you slowly. They lick your hand. Maybe they lick your face. Maybe they keep going and going while their ears are back and their body is low. Some owners say, "My dog is so loving when guests come over." But the body language tells a different story. Dogs often lick when they are stressed, nervous, conflicted, or trying to calm a situation down. This is called an appeasement behavior. It is the canine version of saying, "I mean no trouble, please be gentle with me. I am uncomfortable right now." These dogs may also yawn, pant, turn their head away, show the whites of their eyes, tuck their tail, pace, or avoid eye contact. So if your dog licks you excessively during thunderstorms, at the vet, around strangers, when children hug them, during loud family gatherings, or when you are upset, that licking may be a coping strategy, not affection. They are not necessarily asking for cuddles. Sometimes they are asking for relief. And this is where loving owners accidentally make things worse. The dog starts stress licking, and instead of recognizing the fear, the owner keeps petting, keeps encouraging interaction, keeps exposing them to the thing that is overwhelming them. My friends, if the licking appears in tense situations, you must start thinking emotionally, not just behaviorally. A dog that licks out of stress needs safety. They need distance from the trigger. They need a calmer environment. They may need training support. And in more severe cases, they may need true behavioral treatment through your veterinarian or a veterinary behavior professional. Do not punish this licking. A punished, anxious dog does not become calm. They become silent. And silent suffering is far more dangerous. Now we come to one of the biggest causes of chronic licking in dogs. Chapter 4, the itchy lick. If your dog licks you, then immediately goes back to chewing their paws, rubbing their face, scratching their ears, or dragging their body across the rug, that pattern is screaming allergies or skin discomfort. I see this all the time in practice. Owners think their dog is being affectionate because they keep coming over and licking their arms or feet. But what is really happening is that the dog is in a cycle of skin irritation, self-soothing, and frantic sensory overload. Dogs with allergies often itch on the feet, ears, belly, face, armpits, and groin. They lick because licking is soothing. It temporarily distracts the nervous system from the itch. But of course, it becomes a vicious cycle. The more they lick, the more inflamed the skin becomes. Then yeast and bacteria move in. Then the skin burns even more. Then the licking intensifies. So if your dog's licking comes with red paws, brown saliva staining between the toes, recurrent ear infections, a musty smell, belly rashes, hot spots, hair loss, or constant scratching, please do not write it off as a personality quirk. That dog is uncomfortable, deeply uncomfortable. And here is the part a lot of owners miss. Some allergic dogs do not scratch dramatically. They lick. That is their version of itching. So the family says, "My dog is not itchy, he just licks all the time." My friend, that is itch. Now let's talk about the kind of licking that scares me the most because it is so often hidden under the label of weird behavior. Welcome to Chapter 5, the pain lick. Dogs in pain frequently lick. Sometimes they lick the painful body part directly, like a wrist, knee, hip, paw, or flank. But sometimes they redirect that behavior and start licking you, furniture, bedding, or the air. Why? Because pain creates agitation. It creates internal discomfort. It creates a need to self-soothe. This is especially common with arthritis, soft tissue injury, spinal pain, paw injuries, anal gland pain, and mouth pain. Yes, mouth pain. If your dog is licking obsessively and also drooling, swallowing a lot, dropping food, chewing on one side, pawing at the mouth, having horrible breath, or refusing hard treats, I want you thinking dental disease immediately. Dental pain in dogs is unbelievably common, and many dogs suffer in silence because they keep eating just enough for owners to assume everything is fine. Let me say that again because it is so important. Dogs can have severe oral pain and still continue to eat. So if your dog has developed this strange repetitive licking and something feels off about how they chew, swallow, or carry their head, do not ignore the mouth. Pain licking can also be very localized. If your dog repeatedly licks one leg, one paw, one joint, one spot on the body, that is a huge red flag. Healthy dogs do not obsess over one exact area for no reason. Something there hurts, itches, stings, swells, or bothers them. Now here is where everything comes together. Chapter 6, How to Tell the Difference Between Love and a Cry for Help. I want to make this incredibly simple for you. Ask yourself these 5 questions. Number 1, is the licking brief and relaxed or repetitive and frantic? Number 2, is it easy to interrupt, or does the dog seem driven to continue? Number 3, does it happen in specific situations, like after eating, during stress, at night, or after walks? Number 4, is it paired with any other signs like yawning, panting, swallowing, drooling, scratching, bad breath, restlessness, vomiting, pacing, or chewing paws? And number 5, is this new? Because new repetitive behavior is never something I want ignored. If the licking is brief, playful, and occasional, that is usually normal dog behavior. But if the licking has intensity, urgency, or a pattern, I want you to stop calling it cute and start treating it like data. Dogs leave clues. Veterinary medicine is detective work, and the best pet parents are the ones who learn how to read the clues before the body completely crashes. Now let's move into Chapter 7, what you should do tonight if your dog is licking like this. First, do not scold them. Licking is communication. Second, look at the entire dog. Check the paws. Check between the toes. Smell the ears. Look at the belly. Gently inspect the lips and gums if your dog is comfortable with that. Watch how they swallow. Watch how they breathe. Notice whether they can settle. Third, think about timing. Does it happen after meals, during car rides, in the middle of the night, after being outside, around certain people, during storms? Timing gives us powerful diagnostic clues. Fourth, take a short video. I cannot tell you how helpful this is. Dogs love to stop the second they walk into the clinic and make liars out of all of us. A 1-minute video of the licking episode, the body posture, the swallowing, the pacing, the paw chewing, all of that can help your veterinarian dramatically. Fifth, know the urgent red flags. If the licking is accompanied by repeated vomiting, bloated abdomen, severe lethargy, trouble breathing, collapse, nonstop drooling, signs of intense pain, or an inability to settle, that is not a monitor-at-home situation. That is same-day veterinary care. And finally, if the licking has become chronic, even if it seems mild, schedule the appointment anyway. Chronic discomfort matters. Dogs should not have to live in a body that feels itchy, nauseous, painful, or emotionally overwhelmed every single day. We are coming to the final chapter now, and I want to leave you with this. One of the saddest things in veterinary medicine is how often a dog's distress gets mislabeled as personality. We say, oh, he is just quirky, she is just dramatic, he has always been a licker, she is just extra affectionate. And sometimes, yes, maybe that is true, but many times it is not. Many times that dog has been trying over and over in the only language they have to tell us that something is wrong. The frantic hand licking, the constant foot licking, the lip smacking, the swallow, lick, pace, lick, yawn, lick cycle. That is not always love. Sometimes that is discomfort. Sometimes that is fear. Sometimes that is inflammation. Sometimes that is pain. Sometimes that is a stomach that feels absolutely awful. And the beautiful thing is this: once you learn how to read it, you can help. You can catch dental disease earlier. You can catch allergies before the skin gets infected. You can catch anxiety before it becomes full-blown panic. You can catch nausea before it turns into an emergency. You can become the person your dog believes you are every time they run to you for safety. So if your dog licks you like this, please do not just laugh and brush it off. Pause, observe, listen with your eyes, because your dog may be asking for help in the clearest way they know how. And if this video opened your eyes today and made you realize that excessive licking is not always innocent, please do me a huge favor and hit that like button. It takes 1 second, but it helps this channel reach more dog owners who desperately need to learn how to read the warning signs before they miss something important. Make sure you subscribe so you never miss our veterinary deep dives. And I would genuinely love to hear from you in the comments. Has your dog ever gone through a licking phase that turned out to be something medical? Tell me what breed you have and what the cause ended up being, because your story could help another pet parent connect the dots much faster. Give your sweet dog a big, gentle hug from Dr. Logan tonight. Watch their body language a little more closely. Trust your instincts. If something feels different, investigate it. Stay safe, stay observant, and I will see you all in the very next video.